Hello, my name is Kimberly Allen, and I'm here today to talk to you about the role of peer recovery and family support in optimizing integrated health outcomes. This is segment 8 of 8, and we're answering the question on how peer support is paid for. This project is part of the Texans for Recovery and Resiliency. TRR is a SAMHSA-supported collaboration between the Family Mental Health Network, which is the Texas Federation of Families for Children's Mental Health, and the Addiction Recovery Community statewide network, RecoveryPeople. The purpose of this collaboration is to strengthen peer and family voices in mental health and substance use recovery, policy, and program development. So when we look at peer supporter services and how it's paid for, it's paid for through 1115 waivers as one example. It's paid by private health systems like hospitals, for example, pay for peer supporters. And it's paid by health plans, in other words, insurers like managed healthcare companies as a value-added service. So what that means is that service is not covered under the commercial benefit plan. And if it's not covered under your plan, the health plan takes money out of their administrative pockets and adds it to a bucket, so to speak. And they then have these value-added services, and peer support is one of those. Now, if you look at integrated systems, in this case, an inpatient psychiatric hospital, they do have paid employees. They have paid employees through the Medicaid waiver, Project 1115, like we said before. Others are full-time paid employees. 9 are paid employees. Their title is peer support specialist. 1 is a family partner. So they have full-time employees. They have paid employees. They have peer support specialists, and they have family partners. So they have numerous kinds of employees paid within their healthcare system. They have part-time, full-time, etc. This other large managed healthcare organization said we have peers on staff as employees. Those are internal peers called peer coaches. All of them are in recovery. We also contract and bring peers into our network. There is a regional private psychiatric healthcare clinic, and I talked to their administrator there, and he gave the opinion that many of us have. We need to add peer support as a benefit and have a code so that organizations can bill for it. We need more data around the effectiveness of services. Right now in Texas, there is not a Medicaid benefit that's opened up for peer support. We need to move to add it as a benefit and open up some kind of a payment. So this is a very big deal. We do have private organizations like this clinic here. They would, I'm sure, use peer support services, but they need a code so that they can bill for it. This comes up a lot. What can we do as peers in the future? We can be aware of who our legislators are and the significance of informing them what works and what does not work in peer support. We can help advocate and lobby for a better health system. So if you have questions, let me give you some direction towards some websites. As you can see here, certainly integrated SAMHSA.gov has a lot of information. The Center for Integrated Health Solutions, I name a study here under Peers for Progress, which is talking about primary care and approaches. So that's family physicians and peers. So there's another summary report that comes from health organizations, and a job description, the final bullet on how you can see actual job descriptions in peer support. There's ethical guidelines, which are really important. You can contact me. You can see that at the bottom and write me an email. We have a website, RecoveryPeople.org. We have RecoveryandResilience.org. So my point is that there are numerous sources to look at, and I'm happy to forward those and give you more websites. Thanks for listening today, and I look forward to hearing from you.